So Dr. Valentine Fuster, who is the president of the American Heart Association, but she said the discovery of nitric oxide and its function is one of the most important in the history of cardiovascular medicine. Welcome, everybody. My name is Brendan Burmeyer. I'm a functional medicine practitioner, clinical educator, and researcher. So today on this episode, we're going to be talking all about the most prototypical classic use of nitric oxide, which is going to be for cardiometabolic care and hypertension or high blood pressure. So let's go ahead and dive in. As I'm sure we can all appreciate, and as we talk about on every episode of the More You Know series, we truly are up against this chronic disease epidemic in the United States, where we see that actually one person dies every 33 seconds from cardiovascular disease. And of course, it's far and ahead the leading cause of death for Americans. Nearly half of American adults have high blood pressure, and about 75% of those with high blood pressure don't really have it effectively under control. This is something that we can have a lot of influence and control of through different lifestyle factors and supplementation, as we'll discuss today. So I think we can all appreciate that suboptimal blood flow is a major cause of chronic disease. Every chronic disease is really characterized by decreased blood flow and perfusion to the organ in question. So of course, at Berkeley Life, we're really trying to support optimal blood flow by harnessing the healing power of this amazing miracle molecule that is nitric oxide. So this is, of course, where I like to spend some time on this pathway diagram, this nitric oxide pathway diagram that I created here, that comprehensively illustrates the difference between the more classic, more well-known nitric oxide synthase pathway, as opposed to the nitrate pathway, which is really a pathway that has gone overlooked for way too long. In research in the past 10 to 15 years has really illuminated that this is such a powerful pathway to maintain healthy nitric oxide status and really redox biochemistry at large. Now, we can circumvent a lot of these issues with the NOS uncoupling or the NOS single nucleotide polymorphisms and the dysregulation that can occur over here by leveraging the nitrate pathway and leveraging dietary nitrate or inorganic nitrate supplementation. Now, looking at some of the specific mechanisms of how nitric oxide can promote cardiometabolic health and healthy blood pressure is, of course, by increasing blood flow and supporting endothelial function, supporting oxygenation and nutrient perfusion and delivery, supporting hormone signaling in the cardiometabolic system, acting as a pleiotropic signaling molecule. Nitric oxide also helps to regulate inflammation and oxidative stress in the vasculature, in the endothelium, and also supporting healthy immune function. Nitric oxide helps with glucose disposal and insulin signaling. So there's a lot of benefits when we're talking about diabetes and hyperinsulinemia and hyperglycemia as part of that dysfunctional metabolic milieu, if you will. Now, we also can get better fat burning and energy production from nitric oxide, better mitochondrial function, as well as even supporting the activity in the tone of the vagus nerve. And of course, supporting healthy blood pressure. And by supporting optimal nitric oxide signaling, we can really enhance everything else and make everything else work better. So this is where I want to highlight our gold standard clinical trial that we did previously, and it was the effect of a plant-based bioequivalent inorganic nitrate. So that's referring to our nitric oxide foundation product, and how this affected endothelial function and blood pressure were simply that in this double-blind, placebo-controlled clinical study, we saw an average systolic blood pressure reduction of 12.5 points over 90 days without any diet or lifestyle or medication changes. Now, that's pretty substantial. So certainly you can check out the bullet points here. So there were 67 individuals that were assigned to each group. So placebo controlled, and then of course the nitrate supplementation group. So we actually saw reductions in both systolic and diastolic, while also seeing improvement in endothelial function, as well as seeing a good rise in plasma levels of nitrate and nitrite at all times that were tested. So this was a very, very powerful study that really validates the utility of our product, especially for hypertension and endothelial function, I want to highlight again that nitrate does have prebiotic-like effects, right? So if you're swallowing a capsule of nitrate, your gastrointestinal microbiome, your gut microbiota is going to benefit from those nitrates because of those prebiotic-like effects. Now, this is obviously too why we got clever and released a prebiotic nitrate gum. So essentially what we did was we packed the dietary nitrate into a gum matrix. So that way, as your patients and clients are chewing and masticating that gum, their oral microbiota is able to marinate in that prebiotic dietary nitrate. So we're able to increase the diversity and the nitrate reducing capacity of the oral microbiome, which plays such a critical role in nitrate recycling throughout the body. So certainly making sure that we teach our patients to optimize their nitrate intake. So ultimately being familiar with what foods are going to be rich in that dietary nitrate, our dark green leafy things, our beets, our celery, our spinach, so on and so forth. And of course, lifestyle, sunlight, exercise, movement, nasal breathing, breath work, there's stress management. There's so many just natural, holistic lifestyle foundations that can really optimize nitric oxide signaling and production in the body. So you can really help your patients feel better faster by leveraging the healing power of nitric oxide. So that's the More You Know series. I hope you enjoyed this episode. Remember, health goes where blood flows. Follow Berkeley Life for better blood flow tips, science, and education.